Welcome to Conversations with a Dentist. It is a great pleasure to have with us Dr. Fatima Kurnaz. Fatima, welcome.
Good to be here.
I believe your tagline is Conversations Create Smiles.
Yes.
And that your recently opened clinic is called Y3 Smiles. Congratulations.
Thank you.
And perhaps we could start our first podcast with a traditional Turkish question about where are you from? Nerelisin?
Originally, my family is from Ankara. We are from central part of Turkey. We migrated to Australia when I was about 6 years old. So for the vast majority of my life, we've resided here in Melbourne. Over the last 10 years, I've gone back and forth with Darwin though. So across Australia.
So you were born in Turkey?
Born in Turkey.
And lived the majority of your life in Australia, and you're part Darwinian.
Part Darwinian, yes.
Okay.
That's good part of my life that we spent in Darwin as well.
Okay. Welcome back to Melbourne.
Good to be here.
And tell us about your background overall growing up in Australia.
So I grew up in Melbourne's northern suburbs. We travelled around quite a bit with our families. So Melbourne's north, but we did make our way towards past Geelong for a year or so, and then towards the west, and then kind of settled back in the north. During that time, I kind of shuffled around a few different schools. Finally ended up in one of Melbourne's northern schools for the vast majority of my high school years. Went to uni in Melbourne Uni. Finished my studies, dental school there, and here we are.
And may we ask what enticed you to take up dentistry as a career?
Look, to be honest, I have always been inclined to the health sciences. So it was something that has drawn me to do, coupled together with, the hand skills that are involved, but also that being of service to the communities is a very good part of our profession. So this kind of molds everything into the one field for me, and it's something that I enjoy up until this point in time. So 12 years down, I still enjoy going to work every day, vast majority of the time.
Your father is a doctor, a GP?
Yes, he is.
How much influence did he have on you choosing a related sector?
Look, I think he has always been of the opinion to not do medicine, but then, he has this take that maybe dentistry is the lesser of the health fields in comparison as well. So I think with any health field, because there is quite a bit of investment, time-wise, study-wise, training-wise, medicine being a field of its own, has all of that at a good level. I think he was, quite, there was a quite strong push for something in the health sciences, but exactly what, that's something that I think I took up more myself as well.
Would it be fair to say you have interesting dinner conversations at home?
between battle of the professions,
between
a little
the
bit.
two doctors, yeah.
A little bit, yes. But I think it does centre around patient care as well. So that's the common ground between the two professions, definitely.
Okay. And so how long have you now been a practicing dentist?
12 years.
12 years.
Yes.
And your journey started off in Darwin, is that right?
Yes.
Your first internship?
Yes.
Okay.
My first work or job was in Darwin.
Okay.
After graduating. In Darwin, I worked both in a private setting and a community setting. So did a bit of best of both worlds. And then when I was based in the community clinics, I also worked in the hospital and bush clinics as well. And that's something that I think is very specific to a regional town, where we, during my community work in Darwin, we would fly out to regional, remote Aboriginal communities and stay there for a week as part of our work. Once a month every year. No, so once a month once a week, once a month, 1 week for the duration of the year. So it was good, but
lots of memories.
Good memories. But I'm glad to have done that early on.
Okay.
And then have moved on from that as well. So it's equipped me with that deep sense of serving the community. But, coming back to Melbourne and where I grew up here in the north, serving our community here as well. So I'm glad to kind of have that as my foundation as well.
And did you always want to open up your own clinic?
It has always been on the pipeline. It has something, always in the back of my mind. Yes, we'll get to it, we'll do it. I think finally we've decided to kind of take the plunge the last few years. I think a good push from my husband came along.
Husbands do serve a purpose.
They do. Behind every great clinician is a good supporting spouse. I'm glad that we have done it, and we're here today, 6 months on.
6 months?
6 months.
Okay, congratulations.
Yeah. Thank you.
Okay. And you're in the northern suburbs in Broadmeadows. The exact location of your clinic?
We are on King William, so 1/34 King William Street in Broadmeadows.
1/34 King William Street in Broadmeadows.
Yes.
Just off Blair Street.
Just off Blair Street.
And the northern suburbs is one of the largest Muslim demographics in Victoria and in Australia. Quite diverse, quite multicultural. What would you say has been your initial experience with regards to the northern suburbs Muslim communities' take on dental health care?
Look, I think there's a few common grounds that I can see also within our community, within the Muslim community here in Melbourne's north. The level of dental literacy is on the lower side as a whole. So knowing the importance of oral care, knowing the importance of looking after your care, preventative care, all of this is not at the forefront of our thoughts with respect to your mouth, but also your body as well. So not just oral care, but also full physical body care as well. That general health. So there is quite a bit of a discussion point of discussing with someone with our clients the importance of regular checks, of regular looks in the mouth, checkups, cleans, and ensuring that when we have early disease developing, that we act preventatively rather than let things get bigger and bigger and bigger until we're dealing with vast majority of the problems which are harder to treat, which have a more bigger effect on a patient's or a person's day-to-day life, how they function, how they eat, and all that wonderful stuff as well. So that dental literacy, I find in our community, is on par as general, on the lower side.
Compared to which other communities?
So when I worked in Darwin and some of the remote communities there, the dental literacy there was quite low as well. So it's just trying to kind of break that barrier or kind of, be more in a position to educate as well as treat. One other area that I find within the Muslim community is that there is trust. Trust is something that whether it's because of previous treatments that's gone wrong, whether that's because the mouth is an area where not many people can see properly, so it's an unknown area and it is a very intimate area as well. So there is that mistrust, distrust, and then sometimes overtrust as well. So some people don't want to know what's happening in their mouth and they kind of leave everything up to me to decide, but it doesn't work that way either.
Interesting. Going back to the literacy,
Yes.
low literacy
Yes.
levels
Yes.
in the Muslim community,
Yes.
what would you attribute that to? Culture, the education system in our schooling, other?
Look, I think in terms of accessing care, I think that's
As
one.
in availability of services.
Yes. So, and with dentistry or with dental, because it's not part of, the government-funded Medicare program for the vast majority of population, the children dental benefits excluded, that inaccessibility to dental care, it's just a big void of the unknown. So I think that does contribute to it quite significantly.
How can we improve the literacy? Can we? There are so many independent schools,
Yes.
Islamic colleges up in the north.
Yes.
Would that be a space for an opportunity to create better awareness?
That, yes, I definitely agree. But I also feel as though it's this, this responsibility that we take on as, looking after our body, looking after our mouth. So, for instance, I'll give you an example. If you were to buy a new car, you know that you need to take that car for servicing every 6 or 12 months. It's something that's almost a non-negotiable. You take it needs the oil change, it needs, the tyres to be realigned. So that's a given with looking after your car. When you kind of turn around and say, look, the same thing applies to your mouth as well, just that acknowledgement that we should be doing the same level of servicing for our mouth. It works in the same way. So before problems occur, looking after your mouth in the same way. So I think it's not necessarily, there could also be a bit of a prioritizing involved. Cost always affects certain, decisions as well, or with being able to withhold seeking treatment until it becomes painful. So it is quite multifactorial, but I feel as though, just that understanding that importance of regular dental care, it is something that unless there's a problem, I haven't seen the dentist for 10 years. I've been good. Yeah, I've been good. I haven't had any problems. Yes, I understand, but sometimes we need a deeper look. And we
discover...
multiple things.
It reminds me of the, talking about cars reminds me of the old adage, if you look after your car will look after you.
Yes.
Same thing, if you look after your teeth or your health, your teeth will look after you.
Absolutely, especially towards a later part of, your life. You're going to have these set of teeth for the rest of your life. Yeah. And when you have, your mouth affects almost every aspect of your life. So your ability to talk, your physical appearance, but also when you're eating, if you're missing teeth towards the back, you'll be able to just chew properly, eat your food, enjoy that part of life. Yeah. That gets a little bit, limited in its abilities. So it does affect later parts of your life as well.
You're of Turkish background,
yes.
and part of our common experiences within the Turkish community is that they tend to go to Turkey for their dental treatment, because Turkey has a good reputation of breeding dentists, and the cost seems to be what we
one
may
less
say
factors to factor in,
more affordable. How do you reconcile with? Look, I'm a local, and we provide as good, if not better, care, and there are reasonable subsidies from the government, or I believe for young people there are some subsidies or incentives from the government to send children, the young, to the dentist. how do you reconcile with a tendency to go overseas rather than just go around the corner to your local dentist?
Look, I think with healthcare, that level of continuity of care is something that we're able to provide. When you're dealing with the body, it's a physiological body, it's a biological body. It's not just, a plank of wood that you can kind of treat and then it's going to respond in the same way every time you do the same action to it. So the body heals and responds in different ways. Where you have more extensive treatment being done, one, it takes time for things to heal, for things to integrate, for things to settle down before, moving on to the next phase. So being able to monitor that is, you can't do that in a few weeks' time when you're on a trip somewhere. So one, respecting the body and giving it time to respond, to heal, to recover with certain treatments. And then beyond that, being able to provide that continuity of care. So if things fail, if things go wrong, then there is that scope to, assess what the problem is and to be able to address that in a timely manner before things get worse as well. So before infection starts.
And there's no surprises. Your history is on file.
Everything. So that continuity of care. So what was done, how was it done, the conditions under which it was done, seeing the same clinician or seeing, being in the same clinic also kind of adds to that care involved. So I think those elements really do add to the heightened experience of seeking treatment locally as well.
And good customer service.
Always. You will get the best customer service at our clinic.
I could vouch for that. So tell us about your business, Y3 Smiles, the name, the story behind the brand. Y3 Smiles.
So when my husband and I were sitting down and we were discussing how we're going to come up with the name, we thought we could go for something fairly, business oriented, fairly clinical oriented. Then we kind of tossed up a few options, and I think I remember, just jokingly saying to my husband, what about Y3? And it's like, until then, up until that point, we hadn't really considered it seriously. And then after that point, we couldn't think of anything else. So we kind of got stuck with it. We have 3 children and all their names start with with Y. So hence Y3. So we hope that, our first child, Y3 Smiles, will kind of continue in that way as well. So they're all smiling.
MashaAllah. Okay. You've been practicing for 12 years. I'm sure you've got a lot of memorable moments with patient experiences. What have been some of the more memorable experiences? Keeping without breaching confidentiality, of course.
Yes, of course. So I've got 2 particular cases that still to this day ring, in my ears, on the back of my mind when I treat my patients. One client I saw when I was practicing in the special needs clinic in Darwin, he had been diagnosed with terminal cancer. He had, I think, 12 months or so to go. And he needed a dental fitness clearance before progressing with his other treatment that he needed medically. And, he came in with all of this other emotional baggage, I guess, if you want to say it in that way. We had to do some extractions on him and, carry through with some of the treatment. And they weren't straightforward treatment, but I think what I still to this day ring true with him is that he was able to, he had such a good positive outlook and he was appreciative of what we did and kind of took that on board, even though it affected him quite significantly because, he was on the soft diet for a while and, his mouth was dry. It was, he wasn't enjoying that aspect of his life anymore. And it really kind of brought home for me how important that mouth, the oral cavity is, and how important it is for some of the normal functions to go with it as well. So saliva, something that we take for granted every day, I presume. So he's still, every now and then I'll think about that interactions I had with him, because, just really, it really does. It's really left an impression on me since I've been there. The other case that I still think of to this day is, so with most of the people who I see, the vast majority, they're fearful, there's anxiety, there's apprehension coming into a dental practice. One particular gentleman that we saw, he had to have his wisdoms extracted, and he was really, really scared, like really, really scared, to the point that he actually was crying in my chair. And he had arms full of tattoos, and he's someone who's received injections and needles and all that stuff. So what we were going to do in the chair, sure, it was a little bit beyond that, but he was just having this full blown emotional breakdown happening. And thankfully the extractions were fairly straightforward, and we could treat him in such a timely manner. But he, I think, worked himself so much, got really, really emotionally involved. And then when it was all done and dusted, like, he was left in a bit of a shock to how smooth it went.
That was easy?
That it was easy, thankfully. That's a good example to keep coming back to for me, myself as well, because when we're working with our clients, it's not just the mouth that we're dealing with, but we're dealing with, the person's emotions,
psychology,
and trying to manage that as well, especially when there's no sedation. So, they're fully alert, working alongside that. And it gets a bit tricky sometimes, but we try our best.
Interesting. Some funny moments, amusing moments.
Funny moments. Look, the number of times my fingers have been bitten from patients, as a bit of, not deliberately, I presume, but as a reflex that, if I'm applying pressure here, or if they need to keep their mouth open for a little while. So there is a bit of a tendency sometimes that they just either get tired, or as a reflex bite down. And I've been left with imprints on my fingers from people biting. Amusing moments for them, painful moments for me. Anything else? Nothing that's coming to mind.
Okay, I'm sure it'll come. I mean, for me, when I think of amusing, I always think of kids making certain quirky comments. So we'll take it on notice. As a health professional, health is critical to all aspects of our life. And as a subject matter expert in a particular area of our health concerns, what's one particular pertinent advice you could give to our community with regards to dental care?
So I think having trust in the health professionals, and then keeping up with that regular preventative care. So, establishing some of those relationships with your healthcare providers in the community, and then keeping that regular. So the example that I gave before with how you would service your car, same level of respect to your mouth as well, and your body, to look after it before problems arise, before we and if problems do arise, then that's fine. At least we can tackle it as well, or kind of work through a bit of a plan, rather than letting things get out of control completely as well. So at every stage of your care, there is one way of treating it. But if things kind of are left to be, then that plan changes to something that's more involved as well. So I think establishing trust is important. Knowing that your healthcare professional there is to look after you and your mouth, and then maintaining that regularity as well, just making sure you're keeping up with your checks and cleans. As easy as it is.
Your advice to families with kids?
Start young. So with kids especially, their first visit to the dentist should be the moment their two front teeth erupt. So when they've got contact between their two front teeth, and that usually coincides at about 12 to 18 months of age. So, establishing that trust in the dental setting, so desensitizing them to the environment. When a child sees a dentist for the first time at 5 or 6 years old, some of that damage is already done on their teeth, and we're on an uphill battle to treat this child in the dental chair. And generally, we may need to refer this child to have a general anaesthetic session to have that treatment done. And all of this is actually usually preventable. So if we get started on that when the child is still young, not just with brushing their teeth, but their diet, their habits, and anything else that pertains to their mouth, that there's all that discussion, consultation that happens as well. So it's not just let's count their teeth. There's a whole host of things that we do in those initial years of establishing that trust. So if for whatever reason this child now needs filling at the age of 5, we've already done that groundwork with getting them comfortable in the chair, getting them to trust the dentist. And hopefully it's not an uphill battle, but it's something that we just need to do to reestablish health in that child.
So
start young.
Start young. And it starts with the family, the parents, before school even.
Absolutely.
Yeah. It's the upbringing, it's the conversations which take place inside their household.
Yes.
As we are having a conversation with yourself, families need to have these conversations with their kids.
Yeah.
That prevention is better than cure.
Yes.
It's there's a lot of preventable diseases. So yeah.
Absolutely. I think also with dental decay, it is the number one preventable disease as well.
The number one in the whole health sector.
No, I wouldn't say the whole health sector, but
okay.
It's a maybe I won't make it that big a claim yet.
Not that broad. Yeah. Okay.
Yes. Yes. I think also placing that importance as well. So if you kind of look back, on Muslim population, the importance of brushing your teeth. Yeah. So, using other, instead of a toothbrush, someone may be more familiar with muswak as well. So, the importance of doing that before performing your wudu, that's 5 times a day almost that you should be cleaning your teeth. So you can translate that back to, the number of times that you should be cleaning your teeth as well. So I think there's,
You mentioned miswak, which is traditionally Muslim. What's your recommendation with regards to its usage?
Look, it is something that you can use more towards the front part of the teeth. It can get a little bit too heavy or too hard on the wooden bristles. So if you do go and brush too hard with it, you may cause a bit of recession on the back teeth. But, as an upkeep of your hygiene, I would still be brushing your teeth. You would still be brushing your teeth with your regular toothbrush, but you can use it throughout the day, just before wudu if you like. But also factoring in cleaning between your teeth as well. So flossing, interdental brushes, water flosser, whatever it is you go to, you're still doing that aspect
in
as
addition
well.
to
Using, your toothbrush and muswak if you like.
Okay. A question which is, everybody's always curious in, which toothpaste do dentists use?
Which toothpaste it depends on who you ask. Which toothpaste I use, we just use something off the shelf. Nothing. We go through a few different brands sometimes. Just whatever is easily accessible for us. For our children, though, we use a more age-appropriate, age-specific toothpaste. So at the moment, we've got a 2 to 5 year old toothpaste that we use with the older two. Our youngest hasn't really used too much toothpaste yet. He's not 18 months old yet. So we're not, he gets a toothbrush in there, but not quite toothpaste yet. So he's a little bit young for that still.
So it's not about the brand, but more about the quality of the product that's available in this country.
Yep.
And they're pretty good.
I would say so, yes.
Yeah, okay.
But also easily accessible as well. So you want to make things easier for you to do. So, if you need to get a specific toothpaste that has specific ingredients in it, and it's going to, it's got all of these other factors involved with it, it'll take time for you to obtain that. Whereas if you are to just go to your supermarket, something off the shelf, generally, vast majority of the time is okay to use.
As long as you also visit the dentist afterwards.
Of course.
Regularly. What would you say? Every 6 months? Every 6 months.
Yeah,
Okay.
yeah.
That seems fair. Back to the government supporting the sector.
Mm-hmm.
What do you feel both the state government and the federal government can do to help improve the dental sector, whether it's education, whether it's research, whether it's Medicare coverage, without getting into political agendas? I'm sure there is a lot of window of opportunity for the federal government to support the sector. What would be some opportunities?
Look, I think education is a big one.
In all public and private schools?
Yes.
Yeah.
But I think there are initiatives out currently where, whether it's a school van, whether it's some of the private companies who do that, but, there are initiatives looking at improving that education around oral care. What else do I say?
What about Medicare coverage? Do dentists lobby the government?
I'm sure there are people who do.
Okay. Okay, so that was just one of those.
Yes.
We're having a conversation.
Yes,
here,
yeah.
So okay, but back to so being hijabi. Would it be fair to say that a majority of your clients would be women, or do you get an even mix?
In the current location that I'm based in, it's a good mix.
It's a good mix.
It's a good mix.
Okay.
I wouldn't say the vast majority is hijabi. No, I think we get a good mix come through.
No, a male-female ratio.
Male-female. We still get a good few.
Okay.
I think it's fairly mixed.
Okay,
I wouldn't say it dominates one or the other. Interestingly, though, it also depends on what the patient wants as well. So I'll give you a bit of an interesting case we had a little while ago where, someone specifically wanted to see a male dentist in our practice, and we've got 2 female clinicians, myself included, on it at the moment. And, this person came and saw me, We carried out his treatment, and I think we converted him to having confidence in female practitioners as well. So that was a good win for us on the day.
Okay. Well, that's an amusing story.
Yes.
Yeah. Would you recommend students to consider dentistry as a career profession?
It has a good work-life balance, yes.
It does.
It does.
Good work-life balance.
Yes,
Okay.
unless you're a practice owner. Then you live at the clinic almost. But in terms of, there's a lot of good that you can do. So dentistry itself, whether you work in private, whether you work in a community clinic, whether you go on outreach programs, you are in a good position to provide services to the community in
essential
many
services.
Essential services. And the training involved in getting there is not as involved, is not as arduous as medicine or some of the other professions as well. So it is something that work-life balance is good, and you provide a good essential service as well.
How long does it take study-wise? So
there's 2 routes that you can attain your dental degree, whether it's through an undergraduate or postgraduate way. So they are phasing out the undergrad program. I think there's a few unis that still offer it, but the vast majority of dental schools have shifted to a graduate entry program. So it's a 3-year undergrad, and then you have to do the 4 years of dental school that you do. Whereas I think the undergraduate program is 5 years, if I'm not mistaken, but I'm not too sure.
Between 5 and 7 years.
Yes, minimum.
Okay. It's good to know for all our students out there considering careers. Feel free to visit Dr. Fatima in person. Be encouraged, be inspired, and do consider dentistry as a career. You're pretty much, it's a lifelong career, isn't it? You dentists don't necessarily change careers once they
Look, you can move away from clinical dentistry a little bit.
Okay.
So you can pursue a more academia pathway.
Okay.
There are a few people who I've spoken with who've moved away from clinical dentistry to go on to be product representatives, or people who kind of engage more in that regard. You can do training, or do your own courses as well. So it'll still be around dentistry. I think once you're a dentist, it's hard to move away from it. But it does, sometimes it can be a little bit overwhelming as well. So whether that's physically, whether it's, the stresses of everyday to-day work, what you move away to, I don't know, to be honest.
You cross that bridge when you get to it. Yeah.
If we need to.
Okay. Your final words to our viewers on our first episode.
Look, I think have trust in your healthcare professional. I think we are there to help you. I think once you have that trust, once you know that you're in good hands, hopefully that carries through to ensuring that you prioritize your health as well. So having that regularity with your checks, with your cleans, and looking after yourself. Yeah. And hopefully their effect looking after your smile as well.
So our smile is sunnah. So
smile is sunnah.
And as our tagline for our series is "Conversations create smiles." We hope we've been able to put a smile on people's faces, and please do visit Y3 Smiles. And thank you very much, Dr. Fatima. Sorry. And we hope you've enjoyed our first podcast. And we say keep healthy, keep smiling, and do visit your dentist regularly.
Thank you.